Welcome. I'm Cheryl Mitchell with the Early Care and Learning Partnership, and it's been our pleasure to be doing shows of really current interest to parents of young children with Building Bright Futures. So I'm very grateful to Darla Cynical, who set up this opportunity for us to talk today with Dr. Paco Corbalan and Dr. Monica Benjamin, and also to Sylvie Chouanier, who's at Porter and helps to do all things Blueprint related, but also promoting wellness. So thank you both for joining today. Everybody that I know was so excited when we heard that they could get their kids vaccinated. So we really appreciate you coming to answer some questions about it for people that might still have questions. And maybe the first one is just, why do you think it's important for people to get their kids vaccinated?
Well, thank you for having us as well. We're really excited to be here. So I think there's really three main reasons why it's important to get kids vaccinated. While kids are not at the highest risk group, they can still spread COVID to people who are immunocompromised, and they can still also get severe illness, long COVID, and the multi-systemic inflammatory response that we've heard a lot about in the media. So getting the vaccine prevents severe COVID from happening, prevents hospitalization, and it prevents death. It also can help kids get back to normal in terms of being able to remain in school while sick and awaiting testing instead of having to miss more school. So I think that for me is probably one of the biggest reasons to get kids vaccinated. Additionally, in the COVID cases we've been seeing here in Vermont lately, the 5 to 11 age group is the largest age group of cases.
Oh,
so
wow.
To be able to prevent those cases from happening will be huge as well. I don't know if you have anything else to add to that.
Yeah, no, I mean, I think I agree with all that, and just to add the downstream effects of kids being able to get back to normal means that parents can too, right? So less days missed from work, those sorts of things, which are super important, all of the kind of logistical and economic impacts that this has had. I think getting this group vaccinated will really help with that.
So speaking of the economics, what does it cost? How do parents get a vaccine for their kids?
Yeah, so the vaccine is free. There should be no cost associated with it. And that's true no matter where you get the vaccine. So whether you get it at your doctor's office, at a state clinic, or at the schools, which is another option for kids in this age group, they're going to be coming around to schools. Mm-hmm. There should be no cost incurred to parents.
Wow, great. And many people wonder, so how does it work?
Yeah,
we
get that question
here?
a lot. So it's an mRNA vaccine, which sounds very different to people because this is the first mRNA vaccine that we have ever had. And while it sounds weird that this is the first, this has been something that's been studied for about the last 15 years for not only vaccines, but for also other therapies, including treatment for cancers and other like musculoskeletal disorders like muscular dystrophy. So what happens is that mRNA is something that is already in our bodies. It's messenger RNA, and it's something that helps our bodies prevent illness from happening, and also helps with all our other body's processes. So when you get the mRNA vaccine for COVID, what happens is a spike protein communicates to the spike proteins on the COVID vaccine, or COVID virus, excuse me. I think we've all seen the pictures of the circle with the little spikes coming off. So those are the spike proteins. So what happens is the messenger RNA sends a message to the body that don't let those spike proteins attach in the body. Oh. So our body develops these spike proteins that when it comes in contact with COVID, it prevents it from attaching and then prevents the infection from happening, which is really great.
That's cool. So you're not actually giving the kids COVID.
No.
It's a totally different function.
Yes,
it's like giving the body an instruction manual on how to create the things it needs to create to protect the body from COVID.
Perfect. Wow.
So.
And
cool.
It's also because it's flu season, people are wondering, so which should I do first? Or can I do both? Or what do you recommend?
So you can do them both. You can do them at the same time. You can do them, a day apart. I think whenever you have an opportunity to get either or both of the vaccines, you should get them done, absolutely. Because we're certainly seeing more other respiratory illnesses going around now too. So your flu, RSV, all the kind of things that make kids sick this time of year we're seeing. So flu shots are definitely a good idea to do in addition to the COVID vaccine. And there's no limitation to timing.
And what about, we've heard that the doses for kids this age group is much lower than what adults are getting. Yep. Is it lower than what kids who are 12 and up are getting also?
It is, yeah. So in the 5 to 11 age group, it's about a third, or it is a third of the dose compared to everyone 12 and up. So kids 12 and up get the same dose as adults do. But this younger age group that was most recently approved, they will be getting a third of the dose.
So if your kid is almost 12, should you wait until they're ready to get the full dose?
We have gotten this question a lot.
Yeah.
And the answer is no. So this dose is not based on weight, it's based on immune response. So whatever age your child is on the day they get their vaccine is the dose that they will get. And we definitely have a lot of 11-year-olds that are turning 12 soon that will get the 5 to 11 dose, and then their second dose will be the 12 and up dose. And so in terms of waiting, sure, you could wait, but then you also have that chance of being exposed to COVID and then passing COVID and getting COVID. So getting the vaccine now rather than waiting is always recommended. And we are not concerned about having a lesser immune response by getting a smaller dose.
Oh, great. Okay. And so it sounds like kids are going to need a second dose, and will they need a booster too? What are you projecting?
So just like adults that get the Pfizer vaccine, it's 2 doses 21 days apart. In terms of a booster dose, probably at some point in time down the road.
I don't think there's enough information yet to know exact timing of that or whatever, but I think it'd be reasonable to expect at some point kids would need a booster dose.
Can you speculate about kids under 5?
Trials are happening right now for the 6-month-olds to 4-year-olds. And they're saying sometime in 2022 is when we'll hopefully be able to see that vaccine.
Cool. So what are you two seeing in terms of our parents signing their kids up? What's happening in our county?
Yeah, I think generally parents are really excited about this and, jumping at the chance to get their kids vaccinated. I think for all of the reasons we talked about earlier, I think people really view this as an opportunity to keep their kids safe, keep their families safe, and get their lives kind of back to some semblance of normal. And so, for the most part, I think people are excited about it. People are asking a lot of good questions, and I think understandably have some, things they want to talk through with us, before sometimes. But we always welcome those conversations, and I think at the end of the day, even after talking through all that stuff, people are like, yeah, let's do that.
So people could call their physician ahead of time and just say, and you would have time to answer that, or maybe.
Absolutely.
Yes, always welcome the questions and the phone calls.
Perfect.
And that's one of the reasons that, in our office and a lot of offices, pediatrics offices around the state have really, there's been a push to give this round of vaccines to have it more available in offices.
Right.
So that there is that opportunity to have those conversations and ask questions rather than just popping into a pharmacy or going to a big site where you're just in and out sort of thing. So, we welcome those conversations at any point.
So you had mentioned at the beginning that maybe kids could get it at school. Could they still talk to you and then get it at school because it would be more convenient and they wouldn't have to leave work?
Yep.
Definitely.
Of course.
Okay.
Yep.
Is somebody from your office going to go around to all the schools? How's that going to happen?
It's staffed through the state. So the
Okay.
nurses through the state and vaccine administrators through the state will be going to the schools to give those vaccines.
Wow. Thanks. And we're also wondering, are there side effects? Do we need to worry about it?
So just like with the adult vaccine, the most common side effects we're seeing in kids across all age groups, not just the 5 to 11-year-olds, is tenderness and soreness at the injection site, fatigue, and maybe fever. And the side effects tend to be higher with the second dose that they get, but not seeing really a whole lot more than that. There have been questions about the myocarditis or the heart inflammation afterwards, and I think Paco can kind of speak to that a little bit more.
Yeah, so I think that is a side effect that has been observed with this vaccine, but it's incredibly rare. It is even more rare in the 5 to 11-year age group as opposed to older kids and young adults. And so with this new group of kids who have been approved, don't expect it to be a common thing at all. And the other important thing to remember about this is the risk of getting myocarditis from COVID, the disease, is much higher than getting it from the vaccine as a side effect.
I don't think I hadn't heard that people understood that.
Yeah,
I
so
certainly didn't.
it's, when you kind of weigh risk benefit, it's a pretty small risk of the vaccine, and we don't expect to see much of it.
Oh. Yeah. So I know that you're in a hurry a little bit, but Could you talk to us a little bit about what the last 2 years of COVID have meant for families with young kids and for you as pediatricians who are trying to keep kids healthy?
It's been interesting and really challenging. I think from a strictly healthcare point of view, I think we've changed a lot of the practices that we do in terms of, when kids are coming in sick to the office now, we're not only masking, but we're wearing something called a gown, which looks like this yellow kind of full arm down to past our knees thing that we have on, and eye protection as well. We call it our minion suit because we kind of look at these minions coming into the exam rooms. Whereas before, we would just see kind of sick kids and go on to kind of see the next people, hand washing, and kind of go from there. We're also are seeing sick kids in designated rooms so that we're kind of doing better with germ control and preventing the spread of illness. So I think that has been a big change for us. The other shift we are seeing is that telemedicine has picked up a ton, which is actually kind of an added benefit to the whole pandemic, if you can have an added benefit to a global pandemic, but has made, I think, accessing our office even better and easier for some people to be able to do a telemedicine visit instead of just having to come into the office and that being your only option. I would say that for families, it has been a huge challenge with trying to figure out childcare, work. What does it mean if my child is sick and then I have to miss work as well? And kind of, we talked briefly about the economic downstream effects of that and having that continue to ongo. I probably missed, I'm sure, several things there.
Yeah, I mean, it's been tough, man. It's been a really tough time for families. I think kids are incredibly resilient, and so their ability to adapt to this new normal that changes every day has been, really incredible to see. But also, like, kids pick up on the stress that families have been, feeling for these last, however many months it's been, and we see that, rates of anxiety and other mood sorts of things in kids have been a lot higher in the last 2 years than we've seen in the past. Just the stress is manifesting itself in a lot of ways for kids, and it's, I think everyone feels it. And so the opportunity and kind of light at the end of the tunnel to have some kind of hope for ending that or bringing, calming that down a little bit is a real cause for hope.
I know for my children, the anxiety level went way down when they heard that there would be a vaccine for the kids. It just was such a game changer. So
yeah, it's interesting. Yeah, a lot of kids themselves are coming into the office and be like, "We're excited about a vaccine." I'm like, when have you ever heard that before, right? But,
give me a shot.
Yeah, they're like, this means I can, go play with my friends or whatever.
Right.
But kids are like, "Mom, can you please sign me up for the vaccine?" And so that's been really cool to see.
Very exciting.
Yeah.
We also heard rumors that there would be a pill, so that maybe at some point you don't even need to get a shot. Is that accurate, or those rumors? What's?
I mean, nothing that's probably even close to reality. I think for the foreseeable future, we're looking at vaccines that are shots.
Yeah.
But who knows? Science is amazing. So
It is. It's amazing. Yeah. Well, we're so grateful to both of you for coming in. I'm guessing there's some things that you might like to tell people that I forgot to ask.
There's two things that I'd like to mention. One is we're getting a lot of questions on what does the COVID vaccine mean in terms of my child's future development, their growing bodies. And all of the research has showed us thus far that there has been no long-term effects on development or even short-term effects on development. That's not how mRNA works. It has no effects on pubertal development, fertility, anything like that, which is the really, really good news. The other thing is that in the whole history of vaccines, not just the COVID vaccine, is that any serious side effects are noted within 6 weeks of vaccine administration. So we are well out of 6 weeks of these first rounds of COVID vaccines for not only kids, but for adults and everyone else in all the age groups. And we aren't seeing serious side effects from them, which is the really good news. So I want to also be able to provide that reassurance that there is still going to continue to be long-term follow-up from the kids that were in the trials. They get followed for about 2 years after the trial to kind of monitor things. But again, in the history of all vaccines, after 6 weeks, no serious side effects noted. And so I feel very confident saying this vaccine is safe. And I would also say that I would never recommend to any patient something that I would not do for my own child. So she's only 2. I can't wait till she can get a vaccine.
Yeah, and I guess I would just add, with the COVID vaccine, as with any vaccine, like, we always encourage it to be a conversation. And so whatever questions people have, whatever concerns they have, like, call your provider, call someone and ask them, because I'd much rather have a conversation with someone and kind of talk through things and have someone be sitting at home stewing on concerns that, you know, we can address or talk through. So it should always be a topic of conversation.
So one of the other things we like to do on this show is just to get some sense of the two of you as real people and why you got into the business of working with young kids. And I know that you're both young parents yourselves. I don't know if you're comfortable sharing any of that, and if you're not, that's fine too.
Yeah, I can go first. So
You go first.
I have 2 kids. My daughter will be 3 in December, and my son turned 1 in September. So got my hands full. But yeah, raising young kids in this community has been a really great experience for me. I came here 6 years ago, so did a few years here without kids, and now after having kids, it's been a whole nother element of being engaged with the community, which has been really nice. Less so with COVID because there's less opportunities for that, but you know. Yeah, I mean, I got into pediatrics because I love the kind of that resiliency that kids show that I was talking about earlier, and just the variability that we see in kids, and practicing in a small community where there's a lot of interconnectedness between people, and kind of there's a lot of support that people can draw from, I think was a really attractive piece of working here in Middlebury and in Addison County. So that's kind of why I'm here. And it's been great. I love taking care of the kids here.
Well, we're delighted that you're here. Thank you.
And so I have a daughter, she's 2, and life is also busy with that, as Paco mentioned. And I am here in Middlebury. I started coaching swimming here probably 15 years ago. I no longer do that, but kind of fell in love with the community. And then met my husband, who also was born and raised in Middlebury. So here we are. And I am a pediatric provider because I think kids are amazing, and I love being able to partner with kids and families to be able to reach whatever their health goals are, or not even health goals, but empowering parents to make good choices for their kids or help them with the challenges of raising a child. I think being a parent is the most important job that you'll ever have in your entire life, so being able to partner with families through that transition, because every stage and phase is a transition, has been amazing. So it's been really fun to watch these kids grow up and change, and some of the kids that I coach swimming are now graduating college, and it's just amazing to see that change happen, and the Middlebury community has been an excellent place to do that.
Well, I know, speaking for people who have been in this community for a long time, we are so grateful to the pediatric community here. It's just, we feel so grateful. And for those of you that are watching, you heard both people say if you want to call, ask questions, you're welcome to do that. Their information will show up the website in a moment. And I'd also just want to do a shout out to the Middlebury Community Television Station that makes their facilities available for people to get their messages out. So if you have something that you think it's important for people in our community to know, give them a call. You don't need to know anything. I certainly didn't about television to make this work. So thank you again, both of you.
Thank you for having us.
Thank you.
Okay.